Hi, my name is Dr. Nathan Patterson, and I'm going to talk to you about 5 myths about breast implants. So all breast implants do not look overly big, and they certainly do not look unnatural. It is possible for some patients to have implants that look really large and look really unnatural. Most of the time when patients have that end result, they ask for it in the first place. At least in my practice, that's the way it is. Implants come in different sizes and many different shapes. And so to get an overly large appearance, the patient has to select that in the first place, and the surgeon has to then follow through with that request. I spend a great deal of time explaining to patients what I recommend based on what they start with, meaning what I recommend for the implant type, what I recommend for the implant volume, and what incisional approach I recommend as far as what result they want to get. We talk about what results they can expect with the various kinds of implants that we may choose, whether they're silicone or saline, or shaped or not shaped, meaning shaped or round, or whether they're very large or very small. So breast augmentation surgery and breast lift surgery and any surgery that involves breast implants is real surgery. Just because it's a cosmetic surgery, or frequently a cosmetic surgery, does not mean it's not a real operation. And like any other real operation, there is some swelling and some healing that has to take place before you get your final result. What I mean by that is, you will not see your final result at 2 hours or 2 days or even 2 weeks in many cases. It does take time for your body to heal, and the result does not come immediately. It takes a little bit of time. Sometimes patients get confused about what surgery they're actually getting and what results they can expect. And you should recall that when you're getting breast surgery, the only thing that changes is the breast. That means that breast implants will not make your tummy flatter and will not make your face brighter. It will not make your skin on your neck more smooth, and it doesn't affect other parts of your body. Just remember that breast surgery is just what it says it is. It's breast surgery. It doesn't affect any other part of your body. Most patients find that breast augmentation surgery and breast revision surgery, or even breast reduction or breast lift surgeries, are not as painful as they were told or as they thought it might be. We can usually get patients through the first few days very comfortably with pain medications and rest. Even ice packs help. And most patients don't have a tremendous amount of discomfort with these kinds of surgeries. So many people ask the question, are they going to be able to breastfeed if they become pregnant later? Well, if you have breast implants, depending on what approach is made or what type of incision is made, you should have no problem breastfeeding. This assumes that you were able to breastfeed before, and that is the big question. There's no way to know if you've never had the need to breastfeed before, if you've never had pregnancy and had a baby before. We don't know if you can breastfeed, but most people have no problem with breastfeeding if they're simply getting a breast augmentation. In some cases, if you're getting a breast reduction or a breast lift, that could potentially affect breastfeeding, but most of the time that also does not result in any kind of problem with breastfeeding. Thank you for watching today. If you have any further questions, please contact us at pattersonplastic.surgery or call us at 850-484-7546.